Did you know your fascia has its own nervous system? Fascia is filled with nerve endings that play a pivotal role in our sense of movement and position and directly influence our nervous system. So next time you're practicing your meditation, your cold baths, or your breath work to desensitize your nervous system, make sure you consider your fascia. Utilizing techniques like scraping or Graston or IASTM, known as instrument-assisted soft tissue mobilization, could directly impact your fascia, making it more pliable and putting less stress on your joints and your tendons. Have you ever wondered how using scraping can help speed up your recovery? It's a cheap option that you can use on yourself at home with a lot of results. So within this video, I'm going to be showing you guys a tutorial about how you can scrape yourself at home so it can lead to better mobility, less pain, and better recovery. So when I went to physical therapy school, I was taught within schooling that fascia is pretty much a passive structure, that it really doesn't mean much. It basically is just a big spider web that encases all of our muscles, tendons, joints, organs, everything like that. And it was kind of something that's like, you know, put it on the backpack, we don't really have to think about it. But what we found through new research is that fascia practically has its own nervous system. It's almost like a parallel nervous system because we have a lot of sensory receptors within the fascia. A research study performed in 2017 found that fascia actually has about 6 to 8 times more nerve endings than compared to muscle. This makes the fascial system arguably the body's largest sensory organ. To scrape your body, you don't need fancy $500 scrapers. One of my favorite scrapers is one that's about $30. You can get it off Amazon. This is the one that I use in my practice every day, and it's actually a little bit more effective in my eyes compared to these ones because it's all about the angling and the beveling of the metal. So when you think about scraping, you want to have a little bit of lubrication. I use this lotion. It's called Free Up. It's a physical therapy, massage therapy lotion. It just doesn't absorb into the tissues, into the skin, but you can really use any type of lotion that you need or have. And so essentially you're just going to put a little bit of lotion onto your body. And then what you're doing is all about the angling of this scraper. What we want to think about doing is we want about a 45-degree angle when we're doing this. We don't want to be 90 degrees upright and we don't want to be flat. You want about that 45-degree angle. So first what we're going to do, and this one I kind of like will hold it with my hands here, and you can put your hands through this little part to hold it. When you think about doing this, you're going to scan the tissues first. You're just going to kind of go through it. You're looking for those kind of grainy feelings. When fascia gets a little bit more fibrotic and we have lots of inflammation, we get those little adhesions that build within the fascia. And so that's what you're doing, is you're just scanning the area and finding those areas that kind of, so right about here for me is where I really feel a lot of adhesions. From there, once you find that area that you really need to work into or want to work into, all you're going to do is you're going to take that 45-degree angle and you're just doing a little sweeping motion. You're kind of doing a little sweeping motion, going back and forth, and you can be as fast as you want. You can make big, long strokes, deeper strokes, or you can be kind of quick and fast. A lot of times I'll get patients from prior PTs or prior people who did scraping on them, and they're like, oh my gosh, that hurt so bad. It's probably because they were going at this angle and they were going really fast. So it's kind of a slower, kind of assess the tissues as you go up and down. Having pliable fascia is very crucial because it's going to help the layers within your fascia, skin, and muscle be able to slide and glide on top of each other. If your fascia is stiff, it's going to significantly impact your energy transfer. If your fascia is a little bit more rigid, it's going to put more pressure into those joints, into those tendons, increasing your risk for tendinopathies or tendinitis or tendinosis. Scraping stimulates something called mechanoreceptors in your skin, which can help decrease pain stimulation to the brain. It's also going to break down fibrotic tissue that forms during injury, overuse, or inflammation. It enhances soft tissue healing, mechanically stimulating collagen remodeling to improve tissue extensibility and functional. So the more pliable your fascia is, the more you're able to absorb and distribute forces. It's just that simple. Quiz time! Where do you think we have the highest density and thickest fascia in our body? While you're thinking, go ahead and smash that thumbs up button. I just started my channel and trying to grow this YouTube family and community, so any type of support really goes a long way. The answer to that question is going to be your IT band, upper trap, rhomboids, thoracolumbar fascia, and your plantar fascia. Common issues that are very fascially related is going to be plantar fasciitis, any Achilles tendon dysfunctions, tennis or golfer's elbow, soft tissue in the neck or your shoulder blade, lower back pain, and any scars. Okay, so essentially what we're looking for in our scraping and when to stop scraping is when we see this petechia, these red spots that indicate superficial capillaries rupturing. Scraping helps create that microtrauma to the skin and the tissues, influxing a lot of blood flow and oxygen and nutrients to the area. Question is, when do you stop? You want to stop anytime you're seeing anything past purple. So for me, that's I could probably go a little bit more under there, but you want to stay below that purple. You shouldn't be going longer than about 4 to 5 minutes on each area. So that's pretty much a scraping tutorial. It's very plain and simple, something that you can do at home with just an affordable tool and get a lot of results. Thank you guys so much for watching. If you found this video helpful, be sure to go smash that thumbs up button and give me a follow on Instagram because I give a lot of education on fascial systems and better ways to train your fascia.